Good morning and welcome to your library. The Boston Public Library is thrilled that you have chosen us as your venue for today's important conversations and gathering. It is so great to see many people in 3 dimensions, some people I haven't seen in quite some time. As you came in through the McKim building entrance here on Copley Square, a couple of you may have noticed that above the doorway on the facade is engraved, "Dedicated to the advancement of learning." And so I can think of no better place for today's conversations than the Boston Public Library in that spirit. I have studied the history of librarianship, and some of the research has always indicated that 2 of the most trusted professions in our society are healthcare professionals and librarians. So I know you do not need me to tell you this, but please do not let us squander our joint opportunity. Our residents, our visitors, need trusted information and need our skills and ability so that they can live their better lives. You will have a few breaks throughout the day. Please enjoy the rest of the library. There are spots where they are more geared towards respite and reflection than formal learning. This is your library. Please enjoy the day, and we are so thrilled to have you here. Thank you.
Thanks, David. And now it's my pleasure to introduce our Commissioner of Public Health, the Boston Public Health Commission's Executive Director, Dr. Bisola Ojikutu, who's going to open the conference.
Okay, good morning, everyone. On behalf of the Boston Public Health Commission, I'd like to begin by thanking you all for being here and welcoming you to this gathering. I also want to give a special thanks to Dr. Catherine Hall for bringing us together today. I think this has really been a huge lift. And this has truly been a collaborative effort. So I want to thank our co-sponsors again. It's not just about this one convening, it's really about how do you advance health equity. We need collective action, and we need sponsorship, and we need, to work together, and we need partnership. So I appreciate our co-sponsors in this effort and every other effort that we work on here in Boston. I'd also like to give special acknowledgement to our partners in government who will be here with us. Either they're here, some of them are here now, and some of them will be with us later today. Mayor Wu will be here later this morning, and we'll, thrilled to have her join us in this effort. The Massachusetts State Secretary of Health and Human Services, Kate Walsh, will also be here after lunch. Senator Liz Miranda will be on a panel later this afternoon. We will also see our state DPH Commissioner of Public Health, Dr. Robert Goldstein, will be with us, and a number of our city councilors will be here. So President Ed Flynn, Kenzie Bach, Michael Flatery. We look forward to seeing all of them, as well as a number of cabinet members of Mayor Wu's. I mention all of them because, yes, I think it's important to acknowledge our appointed elected officials, but I think it's important for us to recognize that without political support, we cannot do this work, and we do have a lot of support here in our city, in our state. We can do this, and we can do it together. In addition to our elected and appointed leaders, we also have just a wonderfully diverse and impressive group here this morning. Healthcare providers, researchers, community stakeholders, and activists, just really excited about this opportunity to convene. I also want to mention that we have students and trainees here, so rising leaders in public health and healthcare here in this room. And I mention this, and I say that it's important because what we're here to do is to talk about the future. How can we take the lessons that we should have learned in the past 3 years and actually apply them to the pervasive inequities that I'll talk about a little bit this morning, and of course continue to address COVID-19, especially as the federal emergency ends. I will share that from my perspective, one of the most valuable lessons that we've learned during COVID-19 is how effective we can be when we are actually aligned and when we have a unified mission. That is when we are at our most powerful and our strongest. And I think that that's when we can really accomplish great things. So it's very important that all of you are in this room this morning. One of my goals when I started as Commissioner of Public Health was to find new ways to advance health equity, to address structural racism and systemic oppression in our city. And I would say that one of our most important goals today, and it's your mission if you decide to accept it, is that we need to think about what we need to be doing differently. What is it that we need to do that's visionary? What do we need to do that's unique, that we haven't potentially done before? And then what do we need to do collectively? So to start this process, to get our juices flowing, if you will, I'm going to present a few highlights from our most recent Health of Boston data. So the Health of Boston is produced by the Boston Public Health Commission, and it provides a broad overview of the health status of our city. So it's really critical to how we determine what interventions need to be implemented. So this is a brief snapshot. I'm not going to go through all the data, and full reports will be available soon. So many of you are probably familiar with the data released back in 2012, and that data noted that life expectancy in Boston varied by as much as 33 years by geographic location. So highest life expectancy was noted in the census tract in Back Bay. Lowest life expectancy was noted, lowest life expectancy was noted in the census tract in Roxbury, and that census tract was actually between Mass Ave, Dudley, Shawmut, and Albany Street, for those of you who are familiar. And essentially in Back Bay, life expectancy was 92 years of age, and in Roxbury, at this particular census tract, life expectancy was approximately 59 years. So you probably noted in the media that these data have been quoted frequently. I mean, everybody sort of repeats this data. And even I've noticed it as of like a few weeks ago that it was in one of the newspapers. But I think we need to realize that these data were actually derived about 15 to 20 years ago. These data are actually old. And if we want to advance health equity, we need to know where we are now. So where are we? Let's fast forward. Much has changed, though some things have actually remained the same. If you look at Back Bay, there is a census tract which still has one of the highest life expectancies in Boston. That average life expectancy is almost 92 years. Median income is more than $141,000 per year. 91% of residents have college degrees, and the majority of residents in this census tract are white. In contrast, what about Roxbury? What's going on now? So Roxbury is a neighborhood steeped in Black history, and this picture is of Nubian Square for those of you who are familiar. The lowest life expectancy in Boston is still in a census tract in Roxbury. It's actually a different census tract, but it's inclusive of Albany Street, Hampden, and Greenville Streets for those of you who are familiar. Median income is 30% less than Back Bay. Only 43% of the residents have college degrees. And Roxbury is majority Black, with a smaller proportion of Latinx residents. So life expectancy in that census tract in Roxbury is 68.8, or about 69 years. So this is a life expectancy difference of 23 years. Let's just think about that. So it was 33, now we're at 23. So maybe one might say things have improved, but this is still an extreme disparity driven by structural racism and residential segregation. So we have a lot of work to do. But the problem isn't just in one neighborhood, and I think that's important for us to understand. Let's zoom out and view life expectancy by neighborhood or zip code. By neighborhood, the lowest life expectancy is actually in Mattapan, 77 years, followed by Dorchester and Roxbury, where average life expectancy is 78 years per age. But I think what we need to understand is within these larger neighborhoods, there are micro areas. There are pockets of deprivation, small areas of inequity, where life expectancy is significantly lower than the surrounding areas within those neighborhoods. And you need to have that more nuanced data that I showed you previously in order to guide intervention development. Looking at large areas hides the inequity, it masks the suffering, and really the vulnerability, so it's problematic. So let's turn to life expectancy pre-COVID and during COVID, comparing 2019 to 2020, and looking at race and ethnicity. These data provide a general sense of the impact of COVID-19 on lifespan in Boston. And again, very important data for us to understand where we are. Overall, life expectancy in Boston fell approximately 3.1 years, so it's 79 years between 2019 and 2020. Among Black Boston residents who have the lowest life expectancy citywide, life expectancy fell 4.4 years to 71.8 years, or 72 years. Turning to premature mortality, which is basically looking at the rate of death before 64 years of age. It's an important marker for early death and for potential areas of early interventions. From 2017 to 2021, the age-adjusted premature mortality rate per 100,000 Boston residents increased by 12%. During that same time span, Black residents experienced a 37% increase in premature mortality. And at the same time, there was no significant change in the rate of premature mortality amongst Asian, Latinx, or white residents. What about pervasive inequities within disease entities, which is really important and part of what we should be talking about here? So if you just look at cancer, in 2021, among all race and ethnicities, the overall cancer mortality rate was highest amongst Black men. The mortality rate due to prostate cancer was also highest amongst Black men. The breast cancer mortality rate was highest amongst Black women. Turning to diabetes, these data are also striking. From 20 to 21 combined, the age-adjusted diabetes mortality rate per 100,000 residents for Black female residents was 3.3 times higher than the rate for white female residents. So these are the things we need to pay attention to. This is the pervasive inequity that I'm talking about. So looking at all these data, it's clear we have work to do. Throughout today's discussions, I want to challenge everyone here to think about how we can put what we've learned over the course of the past 3 years into action to advance health equity. I know that many of you in this room have been doing this work for a long time, but we need to sustain our momentum, and we need new energy to tackle these pervasive issues. So today is a renewed and collective call to action. It's my pleasure to introduce our next speaker, Mayor Michelle Wu. I just want to say a few words. When Mayor Wu came into office in 2021, many of my colleagues at that time were actually being disempowered. These are commissioners of public health around the country. They were being demoted, they were being removed from their positions. It was really a tragic time where there was a lot of misinformation, disinformation, anti-science. I want to say that Mayor Wu actually did the opposite here in Boston. She centered public health and really placed value in our work in a way that other folks weren't doing. So not just in regards to COVID-19, but certainly substance use disorder, mental health as a public health crisis, and other issues. And so she actually led by elevating the Boston Public Health Commission to her cabinet. And that hadn't happened in a long time. And she continues to prioritize public health. Her focus on schools, clean air, housing, improving the built health environments, so parks and bikeable roads, really show that she's a strong partner in creating a culture of health here in Boston. And her continued leadership will be vital to our efforts to advance health equity. So please join me in welcoming Mayor Michelle Wu.
Good morning, everyone. I am so delighted to see you this morning and so grateful for all the work that you do across our city and beyond. As you can hear, a cold from a couple days ago is still sitting in my childhood asthma being triggered, and so I will continue to be drinking lots of water and sounding like I have a frog in my throat. But thank you so much for taking the time to be part of this very, very important convening, the first major gathering that the Boston Public Health Commission has held since the pandemic, and a time for you all to be thanked profusely, because I know it has been a very, very difficult several years on top of heroes' work long before COVID-19. Our administration, led by and driven by incredible leaders like the nationally renowned and fearless Dr. Bisola Ojikutu, and so many of our cabinet members and her entire team, our mantra is, we refuse to settle. We refuse to believe that things have to be the way they always were. And that means acting with urgency, that means driving forward with community at the center, and focusing on people, because the solutions for how to solve seemingly impossible, seemingly intractable challenges are already right here in our communities. And that in some ways has always been the brilliance and the focus of public health, to take concepts that can be so wonky or complicated or based on statistics and numbers, and really connect that at the end of the day back to people, how people's daily lives are shaped, and the solutions that in fact so many of our community members are already bringing forward. Long before I had thought about running for office, I found myself walking up 5 floors of stairs every day to get up to the VOS 5th floor at Boston Medical Center. At that time, that's where the medical legal partnership was based. And as a law student, I was trying to find ways to make meaning in a very difficult time in my family's life. My mom had been recently diagnosed with late onset schizophrenia. I had spent the last probably year and a half really flailing and struggling in how, as a 20-something-year-old, to begin raising my two younger sisters, who were 6 and 12 years younger than me. And so I have only come in some ways to politics because of lived experiences and family experiences that have seared into me a passion to try to do right and close the gaps when we have so many families who could benefit from services, who need the treatment, who are steps away from life-saving services and yet feel so far away in a city where inequities persist, where the differences in how our residents feel welcome and whether they feel connected to certain of the amazing world-renowned care play out every day across our neighborhoods. My family story is one that shows how much additional to just the exact diagnosis and medical treatment permeates how families perceive and respond to and are able to access care, stigma, and the very, very significant and important cultural conversations and outreach that has to be part of all that we're doing. The entire family constellation and how issues of housing and work and educational access feed right back into whether medical treatment is actually going to be effective. I spent time at the Medical Legal Partnership working with clients, patients at Boston Medical Center whose diagnoses could not be treated without additional social determinants of health being addressed, whether that was an immigration law case or a housing situation, an education, advocacy situation, or something more. And so here in Boston, we are blessed. Every time I walk into a national meeting with mayors from across the country, I feel a little bit guilty because we are sitting and managing many of the same deep challenges, but with so many more resources here and so many more partnerships. And so I want to thank you all for being right at the heart of our decision-making here in Boston. Public health has to be the foundation not only for how we address issues, how we think about the lens on what we're doing, but also how we connect with our residents. We know that, for example, talking about climate in terms of sea level rise or in terms of how likely we are to, thank you, Dr. Talking about very important and urgent issues like climate in terms of the numbers or sea level rise or chance of a 1 in 100-year storm having an impact on our communities doesn't reach or match the urgency that our communities feel when you talk about it instead in the public health impacts felt immediately of air quality, of asthma, of pollution, of water quality, housing triggers that, housing conditions that trigger larger illnesses. And so we know that the work that Dr. Ojukutu and her team are leading in terms of reaching out to our communities, envisioning a world in which we're opening up doors to every single person in Boston and layering in health, social determinants of health, mental health, connection, building back our workforce. That is going to be the key to making Boston the city that is greenest in America, but also first for families. We dream and are building every day towards being a community that is going to be the best place in the country to raise a family, to have a multi-generational family living and stable and connected to community. And so that is what we fight for every day. That's what we rely on you all to partner with us on. And I'm so, so grateful for all that you do, all the ways that you are not only doing your professional work and involved in your own jobs, but taking the time to then invest in strengthening this larger public health community in Boston and wearing so many civic and volunteer hats and getting involved with us here in the city of Boston. So thank you so much for all that you're doing.